pressure, respiratory rate, blood glucose, their weight, because remember, weight and keep the patient warm. Another important thing to remember, these patients with hypothyroidism are very sensitive to sedatives and opioids, so they're having pain, you need to go with something that's non-narcotic, so you don't want to do narcotics like dilaudid morphine, fentanyl, instead like Tylenol, because these patients are super sensitive to those medications and it can send them into a mixed edema coma, so be aware of that. Now medications, let's talk about the thyroid replacement therapy. With this is a lot easier than hyperthyroidism. Okay, a most common thyroid replacement drug for hypothyroidism you've probably seen if you've even worked in a hospital for a day. If Synthroid seems like everyone's on the Suntory Synthroid, also called levothyroxine, it's most commonly prescribed. You also have Cytomel, also noticed 3, or Levosa random sodium. There's also Side Roller or Leotrix, which is another name for that. So those are the 3 common, but Synthroid is the absolute most common. So patient education, very important. A lot of test questions come from this. Okay, where are you going to educate the patient about? Never stop taking these medications abruptly. These medications take a while for the patient to start seeing improvement in their signs and symptoms, so they may think it's not working, but they need to be educated about that it takes a while. Never just stop, because they can go into the mixed edema coma, and it's best, especially Synthroid, to take this medication in the morning without any food, just water 1 hour before you eat. So early in the morning to take this medicine, that's how you take it. Signs and symptoms of toxicity they need to know in case they were getting way too much of the hormone replacement, which would be your typical hypothyroidism symptoms like increased heart rate, chest pain, heat intolerance. I need to notify their doctor because they're probably toxic. And another thing, don't take these medications within 4 hours of taking a GI med like carafate, aluminum hydroxide, or Smith, also known as Gasset, because these drugs decrease absorption of thyroid medications, so don't take within 4 hours of those medicines. Okay, so that is about hypothyroidism. Now going to take that quiz on my website, register nurseorange.com, and check out the video on hyperthyroidism. And thank you so much for watching, and please consider subscribing to this YouTube channel.